Hello and welcome to the Health Promotion Show. I am your host Frederica O'Hara and this is our special guest Lily O'Hara. Welcome to the show, Lily. Can you tell me a little bit about yourself?
Hi, thanks for having me on the show, Frederica. It's a great honour. I'm currently living in Abu Dhabi, which is the capital of the United Arab Emirates. And you might be familiar with Dubai, which is the more flashy city in the UAE. And Abu Dhabi is about 90 minutes away from Dubai. Think Sydney, more flashy, Dubai, Canberra, capital, Abu Dhabi. That's the relationship. I've just completed a 2-year contract working with the Health Authority of Abu Dhabi to develop and build their health promotion capacity. But before moving to Abu Dhabi in late 2009, I spent the previous 14 years working at the University of the Sunshine Coast. I started working in health promotion before I even knew what it was called. I had completed a science degree and my first job was working for a pharmaceutical company as a medical representative. Although I was supposed to talk to GPs and specialists about the pharmaceutical products, I was actually much more interested in discussing their strategies for improving the health and well-being of their patients beyond just the prescription of their drugs. So instead of talking about our drugs for hypertension that the company was selling, I'd talk to them about how they could encourage and support their patients to be more active, for example. Instead of talking about drugs to control asthma, we'd end up talking about strategies to build their patients' lung function. I then worked with a private consultancy company providing individual and organisational development programs, and we were particularly focused on smoking cessation and smoke-free policy and stress management. I also worked in the area of weight management. Following this, I worked with the Cancer Council on cancer prevention and early detection. And it was when I was in this role that I saw an ad in the newspaper for a postgraduate diploma in the newly established field of health promotion. And I realised then that this is what my work was called. So I did the grad dip, and after I finished I began working for Queensland Health as a Senior Health Promotion Officer in Far North Queensland. And then I moved to the position of Director of Health Promotion at the Sunshine Coast. I was in this role when the University of the Sunshine Coast opened, and I was seconded to set up the public health discipline and the health promotion programs and courses.
What are your particular areas of interest?
I'm really interested in the settings-based approaches to health promotion and have worked with schools and universities and workplaces and even a prison to establish health promotion programs using the settings-based models. In Abu Dhabi, I've established a comprehensive workplace health promotion project, and we have a number of pilot organisations working on that right now. And I've also worked with the Education Department on the development of a health promoting schools project. I'm also interested in addressing issues related to body image and body satisfaction and body size. I mentioned earlier that I'd worked in the area of weight management with the private consulting firm, and through this work I came to realise that although short-term weight loss is usually possible and in fact usually quite successful, particularly if it's driven by body dissatisfaction, that really the physiology and psychology of longer-term weight management were really nowhere near as simple as my study and my practice until that point had led me to believe. And so at that time I gradually learnt about a new approach to body weight called Health at Every Size. And this has been my passion ever since. Over the last 20 years or so, an increasing number of scientists and health professionals around the world have realised that viewing people's weight as an indicator of health is really problematic, and it's also misleading. And despite this, many governments around the world, including in Australia, have waged this war on obesity. Unfortunately, this war's not resulted in mass weight loss or improved health, but instead has resulted in a range of negative outcomes for individuals such as body dissatisfaction, weight cycling, disordered eating, and many other negative outcomes. There's also negative outcomes for society as well, like the increase in stigmatisation of fat people, the prejudice and discrimination felt by people based on their body size, harassment, bullying and violence against people and children on the basis of their body size or shape. So clearly I and many others around the world believe that a much more peaceful approach to addressing our bodies is needed, and Health at Every Size approach is a more caring approach. It's based on scientific evidence. It acknowledges the desire and the capacity and the right for people of all sizes to pursue health and happiness. And the approach really promotes a much more holistic, ecological form of health enhancement. It celebrates size diversity, the natural diversity of shapes and sizes within a community or population. advocates the pleasure of eating well, not just for weight loss or for specific nutrients, but the pleasure of eating well from a physiological, a social, a psychological perspective, and also the joy of movement, so moving because the body loves to move and not because you think it's going to result in some sort of weight loss.
What are your 2 biggest professional achievements in health promotion?
Well, I'd say my 2 biggest professional achievements are really related to my areas of interest, naturally. First, with respect to my settings-based work, I'm really proud of the sustained effort over a decade or so that Jane and I have made towards the development of USC as a health promoting university. And as a result of this work, most recently USC established a permanent full-time position within the human resources team, and it's focused on the health and well-being of the university community. And of course there's many steps that were in the process that led towards this, including student projects where we had students focused on a whole range of things, including assessing the health and well-being needs of the USC community, contributing to health promoting university policies, creating university environments that are supportive of good health and well-being, a whole range of steps. So I'm very proud of this achievement. The other area of significant professional achievement is the development and implementation and evaluation of a number of initiatives using the health at every size approach that I just talked about, especially in this climate in which obesity is the hot topic of the day. So these collaborative projects primarily involve schools as the settings, and one of the projects involved developing a new curriculum unit called Everybody in Schools and implementing this in grade 4 classes at Chancellor State College a number of years ago. This curriculum unit is now available on the website of an American Civil Rights Association. It's part of their child advocacy toolkit, and it's been used in a number of schools in countries around the world actually.
What motivates you to work in the field?
What motivates me to work in the field? That's a good question. Working in health promotion, I think, provides me with the opportunity to make a real difference to the health and well-being of people in the community, and that's a very big motivator. There are so many determinants of health and well-being, and so there's opportunities to work in many different areas of interest. I've just told you about 2 of mine. So although the work is really challenging in times, it's incredibly rewarding and a great privilege.
What do you find challenging about working in health promotion?
Well, I'm often challenged by the feeling that there are so many interconnected determinants of health and well-being, and that the structural determinants such as poverty and inequity are so entrenched in many parts of the world and across the world that it's really hard to know where to start. But it's always important to remember that you're not the only person working to improve health and well-being, and that the evidence shows that collectively our efforts in health promotion do make a difference. So that's one challenge. Another challenge of working in health promotion is the level of misunderstanding that exists, particularly within other health disciplines, about what health promotion really is. There's been, this issue itself has been a significant challenge for me in the Middle East, where the primary health promotion strategies that have been used are health information, think brochures and posters, health education through health talks and health lectures, and of course social marketing using mass media advertising. And these are all important strategies, but in and of themselves they are not what modern health promotion is all about. They make up a part of it, but are certainly not the whole. And these strategies, the dominance of these strategies, and it really reflects the misunderstanding about health promotion, and really the dominance of the biomedical deficit model of health focused on diseases rather than on health and well-being, and the strong behavioural approach to health promotion that's evident here.
What words of wisdom do you have for students studying health promotion?
Words of wisdom, wow. First of all, I think it's really important for everyone working in health promotion, and including students in health promotion, to really understand the values and principles of the discipline and of the profession, and how they are enacted or played out across the full spectrum of health promotion practice that we see, from the very traditional through to the very modern form. Being able to critique health promotion initiatives and understand what paradigm they come from, what assumptions underpin them, what are the implications for practice and for people. All of those values and principles are essential to understand in order that our initiatives that we're engaged in actually make a positive difference to people's lives and that they don't result in unintended harm at the individual level or the political or the social or population level. So of all the courses that you do in health promotion, I guarantee that this one, Health Promotion Principles, is the one that will really make the biggest difference in your life. And so if I have any words of wisdom or words of advice for you, I would really highly recommend that in this course you relish the course, you immerse yourself in it, you be challenged by it, you discuss it, you debate it, so that you become more enlightened and a more critical practitioner no matter where your life takes you in the future. And I still have students telling me this from up to 5 or 6 years ago when they took the course when I was still at USC, that the course has made an incredible impact on their lives, and I hope that the course makes such an impact on your lives as well.
Thanks very much to Lily O'Hara for joining us today on the Health Promotion Show.
You're welcome.